The diagnosis and staging of lung cancer involves a series of medical assessments and procedure to determine the presence of cancer, its type, extent of spread, and other important factors.
Lung cancer is the most diagnosed cancer worldwide, and it is also the most common cause of cancer-related deaths worldwide. Can imagine the magnitude of severity of lung cancer. So, whenever the patient comes with the initial symptoms like cough, shortness of breath, chest pain, we usually get an X-ray done to see, and if we find any significant, any mass lesion in the lung fields, we usually offer the biopsy to get the biopsy done first. Biopsy is the main modality of cancer diagnosis. So, in biopsy, usually we can come to know that what type of lung cancer the patient is suffering from. There are 4 or 5 varieties of lung cancers, and the staging methods are either a CT scan or PET scan. So, once the biopsy confirms the diagnosis of lung cancer, we usually offer them to get the PET scan done. So what the information the PET scan will tell us, we will come to know about the stage of the cancer. There are 4 stages of lung cancer: first, second, third, and fourth. First and second stage are called as early lung cancer. Stage 3 is locally advanced lung cancer, and stage 4 is metastatic lung cancer, when the cancer spreads from lung to the other organs. It's called that fourth stage cancer. You will be surprised to know that almost 60% of our patients, they come with a fourth stage lung cancer. So it is very higher.
A doubt that usually strikes in people's mind: can X-ray be also helpful in detecting lung cancer at an early stage?
X-ray can also help up to certain extent. Usually in our country, if the patient heavy smoker or who has some doubtful symptoms, cough or upper respiratory tract infection, shortness of breath, we usually advise X-ray only first. In X-ray, if we find any suspicious lesion, we order an CT scan.
Medical imaging techniques are generally considered safe when performed by qualified healthcare professionals, and when the benefits of the procedure overweigh the potential risk. However, it's important to note that different imaging modalities may have varying levels of radiation exposure, and certain considerations apply to each technique.
The X-ray itself gives a very low radiation, 0.5 radiation or somewhere around that value only. So X-ray is not at all harmful. Yes, CT scan and PET scan, they usually they gives the radiation quite higher compared to the X-ray. How frequently? Annually, once a year CT with low dose means it is quite lower than that of the routine CT. Low dose CT for screening is quite safe, and for the patient who is already suffering from lung cancer, obviously we have to get CT or PET CT done at the time of diagnosis and every 2 to 3 monthly interval to check on the response or effectiveness of the treatment. 80% of our lung cancer patients, they are actually related to tobacco chewing or cigarette smoking. So my message is that better we should avoid tobacco chewing and cigarette smoking as far as possible. And if you are heavy smoker and if you are above the age of 50 years, yes, you should consult your physician and get the low dose CT scan done as per the physician's advice.